Motion for approval? Aye.
Okay, so let's do a call, and then we also have people online. Last time we had two of our committee.
Here?
Dr. Davenport. Okay. Right now, we're going to move conflict of hearing none. I'm going to move the public comment section. Anyone that's called. Okay, so now we're
Financial presentation for the second month. $986 admissions for the month. Notice budget. Obviously decreases even though we had a decrease budget versus cases. 6 point. admissions still are lagging even after we found tested admissions trending much the same. Average daily census, though, is above budget. That is, predominantly COVID or staying long. Deliveries, this is one that we are close to budget. We were 66 for the month, slightly off of budget, above prior year. On a year-to-date basis, 357 versus 60, less than 1%. And we are above. Surgical cases, we continue to struggle with this and elective being postponed. Emergency room visits. You'll notice that this was last year's numbers, and we budgeted. You can see the decline between last year. We're still trending off of below our budget. So 13.9% off of 1,000 ER visits. Year to date, we're 10% off of budget, 32% off of prior year. Total outpatient agents and service up for the month. This is good, and down year to date. But this is a lot closer than all of our other major ones. So we're having some improvement in our outpatient and service. Urgent care. This right here is a reflection of the COVID tests that we did mainly during the month of November. You can see this whole portion is just the three. I believe it was 3 different days we did the clinics, right? And so it's a huge spike. We'll see a little bit smaller spike in the month of December. ProCare visits. We continue to see a decline there. This is by far, if you look across the last 6 months, the lowest number. Yeah, I mean we're struggling. So we've got double digits in a lot of places. So I will tell you, ProCare actually came in, though we don't break it out, that came in ahead of budget, and that's just due to the management of expenses and some additional rev cycle stuff that they've been able to clean up. You can see we're below budget, 6.3% for the month. We're off 11% to prior year, 10% to prior year. So when you look at where we are today versus this same time last year, which was without COVID, we're down right at 200 FTEs, or 10%. And that has been sort of the running trend we've seen in this organization. Part of that was a noticeable decline we took in the April-May time period. The rest is a function of our volume-related management that the directors have done. Our paid hours per adjusted patient day are doing well. We're at 28.4, which is below budget. We do want to be at or below budget on this, and we're below last year. So we're expending less hours per patient day. And you can see year to date, we're 8.1% off. So as a productivity number, this is a good number. Accounts receivable, we collected $20,182,000. This is sort of the trend where we've been, is right at the $20 million number. Our total accounts receivable at a gross level has held in this area. We've had a little bit of a improvement in overall receivables. We should see some more as our clean claim rate has improved over the last 45 days, and that should help start bringing some of these receivables down. Revenue This is gross billing. So even though we are off significantly in all of our stats, you can see that versus budget on a gross billing basis, we're only 3.5% off of budget and 6.6 for prior years. So shows the higher acuity of patients that we have coming through here. On a year-to-date basis, we're almost right at the same level, 0.4% off. Net patient revenue, we're $24 million. This includes a little bit of the disrupt monies that we have. And you can see we're ahead on a year-to-date basis. So even though we're low on all of our volumes standards, we are collecting the monies and at or better than budget on our net revenue. Other revenue, 5.6. We are a little bit off on this. And here, you can see this is when we got the big spike in the last big CARES grant money. So next month, this bar will roll off and we'll have a more normal graph here. Operating expenses, salary and wages, you would say, well, I thought our productivity was better, but this 14.1 million includes the one-time payment we made into November for all of our patients, all of our employees. That's worth around $900,000 when you throw in the benefits and all. So we take 900 out of that, you can see we're right at budget. And on a year-to-date basis, we'd be slightly ahead of budget, or higher than budget on wages. So we've got a $900,000 unbudgeted expense, but it did pay dividends within the organization. Employee benefits is right in line with budget. Supply expense, we are seeing some strains here. You can see we're above last month. We're above again this month, and that's just due to the continued increase in needed supplies we're having to do for COVID. Purchase services, we're going to have to get into this because we've got 2 months in which we're above budget. We had been able to bring it down. We're still better than prior year, but we need to get back into our purchase services and see if we can bring them back in line. $600,000 difference year to date, but over 2 months, that's still a significant increase. Total operating expenses are 29.9 versus a budget of 28.5. Again, we take out the $900,000 there for the one-time payment we made. We're still above our budgeted operating expenses, but below prior year, and we're right in line here. So I'm feeling good into this number right here. Our operating cash flow or operating EBITDA for the month shows a negative, but remember that includes the $900,000. So you add that back in, we'd only be $400,000 off of our budgeted number and right at the same number for prior year. Year to date, it's even a better story. So it's not big dollars here, 1.5 million versus 2.3 on our operating cash flow, but from a just starting the year out, we're starting out close to budget, especially when we factor in the one-time event that was not budgeted. Total days cash on hand, we're still holding right at the 96, 97 day cash on hand. So we have come down. This will come down a little bit further as we clean up some stuff for end of the year. But overall, we still have a very strong cash position at this point. I would say, looking at this is probably the most encouraging thing right here, is to see that our operating EBITDA is close to our budget, even though our volume numbers aren't where we need to be. If we had our volume numbers, we most definitely, just given the way we're able to bill and manage our expenses, be at or better than budget. Any questions, Madam Chairman? All right, thank you very much.
Man, that does not forward payment.
The forward payment ban, I've got that little note hidden up here in the small print. So yeah, there's another $30 million or 30 days worth of cash that we're just got socked away in a savings account in case we really have a big issue.
And I this time last year, that I had a shocking experience with our auditor, and we cleaned up about
Yeah.
like millions,
Yes.
and we don't foresee that.
No, sir. No, sir. We've gone through that. We've talked to our auditors. They're in the midst of our current audit right now, and right now they're not bringing up any major issues. If they did, we'd bring it to y'all. We'll know for sure this time next month, because they should have all their field work completed in the next 2 weeks or so.
Yeah, don't forget, we made about a $13 or $15 million
Oh, yeah.
cleanup adjustment
Yeah.
last year to get us back on track.
Yeah, big deal.
So we're on time for the audit, we'll
Yes.
be pushing it back.
Right now, we're not
We're not seeing
anticipating.
any issues, we're gonna be on schedule.
Yeah.
We're getting
The big push last year was to try to get our net revenue right, which is that adjustment he's talking about. And it took us an extra month to prove the number that we needed to be at. So we're not anticipating that this year.
the big cash on hand, with everything that we've been through this year, I mean, you just look back to a year ago,
Yeah.
it's pretty amazing.
Yeah, in this time period right here, I was not sleeping very well. I was thinking we were going to be even lower than these charts right here, but just given the changes we've been able to affect, it's been good. Yes.
I'm really impressed. Because that number is really good for what we've been through this year. Do you have any questions for Mr. Ewing? Has anyone else logged in, Kirsty? I just want to make sure I don't overlook them before we vote on this.
Thank you.
I don't see anybody else.
Okay. Okay. And Dr. Davenport and Dr. Benton, if y'all are on, y'all speak up. We're not seeing y'all. Okay. All right, so I'll entertain a motion for the financial report.
Make a motion for approval. I second.
I have a motion and a second. Any discussion? All in favor, say aye.
Aye.
All opposed, motion carries.
Thank you, Steve.
Thank you.
And then we're going to move into the consent agenda. I'll entertain a motion for that.
Make a motion for approval. I'll second.
I got a motion and a second. Any discussion on consent agenda? All in favor, say aye.
Aye.
All opposed, motion carries. All right, now we're going to move into our capital expenditure request. Our first one on the list is consider approval of instrument tracking system.
Madam Chair. The first one in your packet is our instrument tracking system, which is a portion of your sterile processing department, which impacts your sterile or your surgical services. This system facilitates the meeting of our regulatory standards for tracking instruments used on a patient back to the actual patient, managing employee competencies, and then it monitors the sterilization equipment parameters, keeping us within our regulatory requirements. Currently, this is a manual process, so it takes a little bit more out of our productivity for the staff down there. And if anyone misses a line or forgets to document something, then we can't trace it back to a patient, which obviously is something that regulatory really watches. So this system costs $99,237, and then this will allow us to electronically track every piece of instrument used on every patient and tag to all the cases, as well as start looking at our employee productivity down there in that department.
Make a motion for approval. I'll second.
I have a motion and a second. All in favor, say aye.
Aye.
All opposed, motion carries.
My next one is our True System 7000 standard cable package. This is actually the table that goes with our XI robot. This is a ratification of purchase. When we purchased the robot, this table was not included in that, and so in order to utilize that robot, we had to purchase the table for the patient. I'm happy to say we do have the table, and we're actually running the robot a few times a week, both robots at the same time. So this is just a ratification of that. $115,066.87.
I want to note to everybody online that Dr. Benton and Dr. Dowd, so they're now part of our meeting.
What was the dollar amount?
Sorry, $115,066.87.
Make a motion for approval? I'll second.
I have a motion and a second. Any discussion? All in favor, say aye.
Aye.
All opposed? Motion carries.
Okay, my next two are related to the same thing, so I'll just give you a summary for both. In the maternal child world, you've seen our deliveries continue to grow over many, many years. When we first built the Center for Women and Infants, we only outfitted 2 of our ORs up there, even though we had 3. We felt like with the volume, we really weren't ready to set that one completely up. With the current volume and the but the increase in the acuity of the cases we're seeing, we're having to take more down into our main OR to do those C-sections when there's an emergency, because we already have 1 or 2 procedures going at a time. And in order to have safety, we really need to leave 1 open at all times. So what we've done is asked for 2 different purchases after visiting with the OB med staff. One is an anesthesia machine for the 3rd OR, and one is the purchase of a panda warmer for the 3rd OR. Both of those will allow us, along with some other minor equipment and supplies, to outfit the 3rd OR, which would allow us to do 2 OR suites consecutively and have that 3rd OR as backup, and if it's used for an emergency, then take the 4th patient down to the main OR. So it's a safety factor as well as an increased volume factor. So the Panda warmer is actually $15,267.66, and the anesthesia machine is $98,621.64. And this is also another ratification of purchase, because when we talked to the OB med staff, Mr. Tippin felt like this was really a safety issue that we needed to jump on, so that we had it rectified after the 1st of the year. So we went ahead and made those purchases before the manufacturers closed down for Christmas, so that we could really get started on that after the 1st of the year.
I'm going to break these up, and we talked about them together, but we're going to vote on them separately. So the first one we're going to vote on is the Panda warmer.
Make a motion for approval? I'll second.
Have a motion, a second, any discussion? All in favor, say aye.
Aye.
All opposed? Motion carries. Okay, now we'll go ahead and vote on the anesthesia machine.
Make a motion for approval? I'll second.
Have a motion, a second, any discussion? All in favor, say aye.
Aye.
All opposed? Motion carries. Thank you.
Thank
With
you,
that,
ma'am.
we're in adjournment.